will harry the public servants until you get the answer you're satisfied with. And so when I saw the city absenteeism story, I went, he must have had fun reading that report. And I know that you were upset. Brenda Johnson was very upset with this. The whole absenteeism issue, it's skyrocketing. And, you know, coming from private, I've always almost admired, you got a public service job? Oh, that means you can plan your extra days off. And it's just an insidious little illness that runs through the public sector. And I'm generalizing, not everybody does this. But this is an outlandish number that the city of Hamilton is dealing with. South of $11 million?
$11 million, that's correct.
That's astounding.
Annually.
Astounding.
Yep. And
what do we do about it?
Well, the first thing we needed to do was actually start to crunch the numbers and look into it to find out exactly what was going on, because we were getting these reports and they were done in statistical formats, and sometimes when you get a statistical report, it's a little bit challenged to dive in head first and start attacking the numbers to find out where they're coming from. So the first thing we did is we requested a broader report that indicated just different departments and what the different departments were reporting as absenteeism. That started to show different alarm bells. So now when you see, for example, the finance staff having very little time off as a part of illness, and you see other divisions with much higher, and now you start to try and understand what's going on in the culture there, what's going on in the supervision, what would cause an employee to be ill. Could it be legitimate occupational health and safety things that they're being exposed to that we don't know of? So there is a lot of work going on to get to those numbers and get them to a reasonable level. But more importantly, we're bringing it to the staff's attention. We've brought it to the manager's attention. We're expecting them to manage those numbers, to ask those questions. Why were you off? It's unacceptable for someone to stay home on a free day and go to the Blue Jays. That's unacceptable. That for all intents and purposes, that's time theft. And so we want to make sure that everyone understands the rules, everyone's being treated fairly, and if you're breaking the rules, the city will deal with it.
What was the average number of days?
I don't know off the top of my head. I was thinking it was around 10 or 11 at one point.
And did I read correctly that you don't need to bring a doctor's note until 5 days consecutive?
That was the policy, yes.
So I assume that's a negotiated policy, because in private industry, of course, it's 3 days. Everywhere I worked, it was 3 days.
You can do it in one day. You can say if you're off, and I've worked for employers that have said, listen, if you're off sick and you're that sick, then you should have gone to a doctor, bring a report. The response that I got from some on staff was that, well, we don't want to make our problem the doctor's problem by having a bunch of sick people going to doctor's offices. And my response was, if they're sick, they should be at a doctor's office and get the note. And the note in itself becomes the deterrent. So if you're scamming the city, then you should be getting that note and paying for that note. And that's the cost of scamming the city. And if the doctor refuses, then you've got some splaining to do.
You mentioned the words time theft, and I know you were dealing with GPS and garbage trucks today at General Issues Committee. And of course, the Spectator broke this story. And is it time theft if it was accepted practice by management, or is it truly time theft that many trucks go out on their routes and then at 12:30 they're done, they're gone for the day, and that is acceptable? Part-time pay for full-time, or full-time pay, I should say, for part-time work? Is that acceptable? I know you had some comments about that.
Yeah, and I wasn't.
Again, number crunching.
And I wasn't pleased with the way it was handled, because after digging in further and finding out that there had been this unwritten policy that managers had followed for probably decades, that if you get your route done quickly, you can go home. They didn't tell us that. I mean, when the story hit the fan, if you will, there was a little bit of obfuscation, and they didn't get to it directly. We need to get these answers quickly. We need to understand what's going on. But more importantly, from my perspective, you know, I was the Minister of Labor, and I can tell you that if you're sending trucks down the road, and the faster they go, the faster they can go home, occupational health and safety issues go out the window. So how many accidents have incurred as a result of this practice? How many people were injured on the job as a result of this practice? How many trucks were hitting other vehicles as a result of this practice? You cannot send out a garbage pickup team and tell them to go as fast as they can so they can go home early as the incentive without naturally incurring issues where safety went out the window. And so I'm really concerned about that, and we hope to address that also.
There's several other things that I want to address, but we're under 3 minutes already. So I want to direct you to a 6-month-old story, and that's the Nualta application to bring in